It's okay, madam.
Okay, thank you. You can see my slide moving.
Yes, madam.
Yes, okay, thank you. So I have 45 minutes, and I intend to talk on epidemiology of dengue in Sri Lanka and the current strategies in the program, and what actions are implemented to reduce morbidity and mortality, and some of the challenges we face in dengue control. To start with, as you all sometimes know, that dengue was serologically confirmed in 1962, and thereafter several epidemics have been reported on and off. And this is a landmark year in 1996. It was made a notifiable disease, so it was added to notifiable disease list in 1996, and thereafter it is under regular surveillance, routine surveillance. So, and in recent also, some strengthening surveillance mechanism has been implemented, which I will talk of. And with that data, we have seen that which was earlier recognized as a urban disease has now spread to rural areas as well because of the multiplication of breeding places of the Aedes mosquitoes. This is the epidemiological triad, and as you all are familiar, there are some viral related factors, host related factors, and environment related factors. Regarding the virus, there are 4 types of viruses, and one person can get 4 dengue infections in lifetime. And there are host factors about the vulnerability and exposure to the virus and the mosquitoes, and some environmental factors which regards to the breeding sites in the domestic and peri-domestic environment. Some factors are environmental related, climate related, which cannot be modified, but there are other factors like culmination of breeding places in the environment, which can be modified by human behavior. So it is very much important that people are mobilized to inspect their breeding places and eliminate the potential breeding places regularly, because the life cycle of the mosquito takes about 1 week from egg to adult mosquito. Therefore, we have to eliminate the breeding places at least once a week to break the life cycle of the mosquitoes. In dengue control, the prevention of mosquito is one of the main strategy in primary prevention, because unlike in some other diseases, vector control strategy has to be strengthened. This is the reported number of cases since 1989. So you can see here, this is nearly for 30 years, and you can see here that each bar chart indicates the number of cases for each year, and we have experienced the largest outbreak in 2017, and so far we have received nearly 14,000 patients for 3 months this year. This red line denotes the case fatal rate, that is the number of deaths per 100 patients. So you can see here, if we are to start with case fatal rate in 1989, so nearly 10 patients have died out of 100 patients. This has been reduced to 0.1 now because of the interventions that have been carried out in case management. We have improved the clinical management, training programs, infrastructure facilities. Therefore, the deaths have been reduced remarkably. This is again the same thing. You can see here that how it has been reduced over the last 2 decades. This is the seasonal pattern, and you can see here that there are 2 distinct peaks associated with monsoonal rains. One mid-year and also the other one towards the end of the year. Probably you would have heard of National Dengue Mosquito Control Weeks, which we implement prior to the onset of rains in order to mobilize the community to undertake removal of breeding places from their environment, so that once the rain starts, there would be much less potential breeding places in the environment. In order to prevent the outbreaks, there is one strategy we have been implementing. Once the forecasting of dengue is done, associated with the monsoonal rains. Towards the end of the year, we have seen the rainfall mainly in the northern and eastern provinces, and the outbreaks generally occur in these districts towards the end of the year, and we strengthen the preventive activities prior to that. This is the comparison of cases reported from for 2020 last year and this year, and you can see here in the blue bars that last year after September the cases have been increasing, and after December there is some reduction in January, but in January, sorry, not really reduction. There is a increase of cases in January, and after February there is some reduction, and still with the onset of southwest monsoon rains, we expect outbreaks in mid-year. So we have to take actions in advance at district and MOH levels. When we analyze the number of cases that have been reported in 2021, we can see here that nearly 66% belong to the working population, and nearly 1/4 belong to the school-going population. So it is important that we prevent mosquito breeding in schools and also in their tuition classes. So wherever they attend, including the houses, and also the working population are also at risk, because they mainly the laborers and the laborers who work in say construction sites, because of their type of occupation, they also are they are also vulnerable. So when we analyze the cases by sex, we can see that more men are contracting the disease. The deaths for last year, there have been 28 deaths, and 16 were males and 12 were females. The National Dengue Control Unit has developed we have a national action plan, which you can see here. So this is our national action plan, which is available in the website, and our vision is to you can to save time, you can go through this, and we have 2 outcome objectives. The first is to reduce the incidence of dengue to 100 per 100,000 population, and to reduce the case fatal rate also to 0.1 per 100 patients. So we have achieved the second one, but I will talk of the present incidence in the next slides. So we have these are the specific objectives you can go through. So we have to intensify epidemiological surveillance, entomological surveillance, and integrated vector management methods for vector control. Vector control is one of the major strategies. We have to improve early diagnosis to prevent complications and deaths. We have to detect epidemics early. The curtailment of epidemics and rapid prompt action is very much important. Before it spreads, we have to identify the foci before it becomes multiple foci for transmission, and monitoring evaluation of the program activities and operational research. So these are basically the main objectives. These are included in our National Action Plan. These are the activities at national level. Our office is located near the blood bank in the public health building. So this is the incidence. I told you that we aim to reduce the incidence to 100 per 100,000 population. And as you can see here, Sri Lanka, for the whole Sri Lanka, it is 162 by now. And in 2021, the highest incidence was reported from Batticaloa district. So there is wide disparity among the districts, as you can see here. This is the changing pattern of incidence in with the outbreak. High incidence was reported in 2017, and now it is this much. And the case fatal rate also, you can see here, it has come down. Excuse me, could you give me 1 minute, please, for an urgent matter? There is.
Okay, madam.
1 minute, please, sir. There's something that I have to attend outside. Okay. Sorry about the interruption. Okay, I will restart. I will continue. And so this is the case reporting or proportion of contribution by different districts. And as you can see here, generally from Western Province, we get about say 50 to 60% of caseload each year. So there are so many factors for this. One is the population density and some social factors. A lot of people come to urban cities for their occupational activities and so on. So there is a lot of multiplication of breeding places in the Western Province, and the incidence has, you can see in particular district, the highest incidence in 2021. So this is some of the activities conducted by the National Dengue Control Unit. And if we are to talk of our first component of a strategy, surveillance. Surveillance is very much important in disease control programs. As you know, it is really the backbone of any disease control program for identification of high-risk areas, resource allocation, and other inputs like training and other developments. And in dengue, we have several surveillance systems. Passive surveillance, that is the routine surveillance via H544. And we have special surveillance forms for each patient that was treated for dengue in hospitals. That is a special surveillance form which has detailed information. And the sentinel surveillance is very much in use. It is a online platform to collect data from hospitals. For example, we have about 120 hospitals where the infectious control nurse notify the details of the patient who are admitted to the hospitals online to the National Dengue Control Unit, Epidemiology Unit, and district level officers, and also the area where the MOH where the patient resides. So thereby the local level quick response activities can be initiated by the central surveillance, because the postal delays are avoided with the online system. This is the, we call it DENSIS, and there are variables like the province filtering, province districts by MOH. We can monitor the number of cases. And this is a screenshot of the DENSIS. You can see here the by week, for example, for the second week in MC Colombo area, 16 cases have been reported, and in the third week, it is 31. So when there is difference of more than 5, it is there is a red flag. So now we are going to develop more sensitive notification system with some more variables like the patient's occupation and outcome of the investigations and so on. You all are familiar with the disease surveillance system conducted mainly by the epidemiology unit. So we have another surveillance system for the viral serotypes. This is we collect data from some major hospitals of the patients who are admitted with dengue during their viremic phase. We get blood samples and sent to Medical Research Institute and also University of Sri Jawadhanpura Center for Dengue Research. And here you can see that all the 4 viruses, but except for have been circulating. And for 2021, these are the we have checked 437 blood samples of viremic patients, and majority have dengue type 2, and type 3 also has a major component. What does this mean? This means that as you all know, one patient can be exposed to dengue several times, and the viral serotype that one has been exposed at present will give immunity throughout life. It doesn't ensure that the other serotypes are not infecting the patient. So reinfection has to be prevented. And when there are multiple serotypes, one patient can be exposed during their lifetime to other serotypes as well. And it will there's a possibility of more complications with subsequent infections. This is in 2022 also we can see that type 2 is more prominent. So that is a surveillance in clinical management. It is one of the key strategy. And as you know, dengue, it is a wide spectrum, and you are familiar with this. Of the infected patients, only few will show symptoms, and majority are asymptomatic. So those who will have fever have to be, that our message is that those who get fever with the suspected dengue to go to a medical practitioner 24 hours after the onset of fever, because we have seen last year that patients are reluctant to go to a hospital for fear of COVID. And we have seen late admissions to the hospitals because the patients have been staying at home without seeking the medical advice. And in some, the reduction of platelets and also leaking has already started while they were at home. The National Dengue Control Program has established high dependency units in major hospitals up to base hospitals, and training and also capacity building has been conducted. You can see that case fatal rate also has been reduced. And these are the guidelines developed by the epidemiology unit, and guidelines for adults, pediatric patients, and also for general practitioners and for management in pregnancy. These are available in the websites. The third strategy is the integrated vector management strategy. That is this has several components. You don't have to know the details. What are the vector control methods we have? I will discuss it in the next slide. This slide shows similar to the disease surveillance, we also track the mosquito population by vector surveillance activities conducted at the MOSH level in high-risk localities, and the larval, the immature stages, larval pupal stages are also collected, and there are some spot surveillance in high-risk localities like construction sites, school, hospital, or other institution. We conduct high spot surveillance to find out the occurrence of outbreaks and forecasting, etc. These health entomological officers are attached to the medical officer of health area and also at district level. And at district level, entomologist is there in most of the districts except 2 or 3, like Mullaitivu, Kilinochchi, etc. There are some indices for the calculation of vector density, like house index or premise index. That is the percentage of houses infested with larvae or pupa. Container index, number of containers infested with the mosquito immature stages. Brito index, that is a combination of 2. Number of positive containers per 100 households. So these have to be analyzed, and control activities are strengthened if they routinely. But there are some shortcomings, like this number of container. When you say container, even a yogurt cup is a container. Large tank also can be a container. So when we analyze this data, we have to see the productivity and also the risk of each container in relation to the number of larvae that is present. There are several vector control methods. Environmental management, that is the cleaning the environment. So cleaning your roof gutters, concrete slabs, and source reduction activities by removing potential dry and wet containers, tires, tires, water storage tanks, and everything comes under the environmental management activities. And chemical methods are there. For example, if there is a tank that you cannot demolish, so you cannot remove, in that case you have to add some chemical methods like larvicides to kill the larvae immature stages. Other than the chemicals, we can use biological methods like adding fish, or there is this BTI. BTI is has limited value because it has only about 2 weeks active period, and we can't put it every time regularly, and there are some other growth regulators and so on. Intersectoral collaboration is very much important for sustainability, and there's a place for law enforcement. In the life cycle, you can see here, out of the 4 stages, 3 stages, that is the eggs, larvae, pupa, they live in water. So these containers may be in our household, inside, outside our residence, maybe in our children's schools, maybe in the working place, our universities, or wherever, in our religious places. All the places have this type of breeding places with the larval stages, sometimes with water or without water, but it has the potentiality of getting water and also a breeding place for the mosquitoes. So it is very much important when you work in curative sector or public sector, that when you come across dengue patients, that behavior reinforcement is necessary, because at that time, when they are in hospitals, if you say mention about this, they are very much receptive to listening. Environmental management. So this environment management varies from area to area. In some areas, the prominent breeding places may not be the same in some other areas. For example, these roof gutters, these shallow wells. We have seen mosquito breeding in the shallow wells, and also open shell tanks also can have breeding places. There are some open cement tanks also. So we advocate replacing them with the shell tank with the lid. So there are so many health education activities for social mobilization, resulting in community environmental management to reduce vector breeding. So this is, all the things are integrated. There is no one single activity whereby you can reduce mosquito breeding and control dengue. One important thing is, so in environmental management, proper disposal of solid waste, used tires, and those things are also important. And prevention of man-vector contact is also important, because the mosquitoes who have the virus will land on your skin, and through its saliva will enter the virus into your body. So it is very much important that the man-vector contact is reduced. This mosquito net, you might wonder why it is, because this mosquito is mainly a day biter in the morning and in the dawn and dusk. But sometimes when someone with fever needs to sleep during daytime, even sleeping under mosquito net has much preventive effect, because the viremic patients can't give the virus to the mosquitoes if they are sleeping under a mosquito net. Most people rely on chemical fogging as a main strategy for prevention of dengue, which is really not. By fogging, only the flying mosquitoes, which we assume will have virus, especially during outbreaks, will be killed, whereas the larvae or pupa in a coconut shell lying on the ground will not be killed with fogging. So therefore, fogging is to augment cleaning programs and source reduction activities, and it is especially useful during outbreak periods where the female mosquitoes are carrying the virus from virus to infect other healthy people. These mosquitoes mainly test indoors. Therefore, the indoor fogging has to be done, so it has health hazards as well. Therefore, prevention of mosquitoes and source reduction is the main strategy. And there are two methods of fogging: thermal fogging, where the chemical is mixed with the diesel or kerosene, and ULV fogging, it is mixed with water, and the health effects are much less. So for indoor fogging, probably we can use cold fogging. These are the biological methods. We can put, if you have a pond inside, we can put this larvaceous fish for wells, ponds, etc. In construction sites, pose a big problem in dengue, because they have a lot of garbage and vulnerable population. So there are some, there are some inbuilt training programs for the constructor sector for the prevention of bleeding in the sites. I mention this because most of the universities, schools, and also government institutions have a lot of breeding sites in their vicinity, and sometimes the mosquitoes spread outside the site to the neighboring areas also, posing a threat to the neighborhood. These are some legal enactment is conducted for the repetitive offences and also for the major against the major breeding places, and there are some notices issued by the teams when they have a lot of breeding places in a site, and when the householders are unable to clean them on the same day, they are given a red notice to clean it within 3 days and inform the MOH office. And when the household is closed, this is also placed on the door and being followed up by the MOH. Strategy 4 is of control program is intersectoral coordination and social mobilization. Why intersectoral coordination? Because the health sector alone can't control dengue, because some of the solutions lie outside the health ministry. Therefore, we have to get the support of other sectors as well. For example, education ministry, then construction and housing ministries, and local government for garbage disposal, and also this public and public administration ministries for the Graminadari support and this division secretary support and so on. Therefore, and fisheries ministry, because some of the breeding places are found in the fisheries harbor, in the boats, unused boats, and so on. So therefore, the support from each ministry or each stakeholder is very much important for sustainable efforts. We aim at multi-sectoral approach. Why we need to mobilize the society? Because sometimes the society is immobilized in terms of dengue, and sometimes the society thinks that it is the responsibility of the government to control dengue fever and so on. It is not so, because the government officers or health sector can't visit every house, every premises regularly to inspect the breeding places and control it. It is the behavior of the community or owner of the house, the residents, that have to do this regularly in their domestic and peri-domestic environment. So the health sector can support it. The medical officer of health, PHI, Graminadari, village committees. So these committees are very much important, their active participation, and they have to discuss their own problem. We have strengthened this street committees for COVID also. Now they have been incorporated about dengue preventive activities also. If they have dengue in the area, the PHI will inform the membership, and they will meet and discuss. For example, if there is a bare land where everyone puts garbage, so these things have to be resolved by the local government and the local level officers, and also by the surrounding this neighborhood. So like that, they take their own decisions and own solutions are encountered, so that they are constantly engaged in dengue control activities. These are some of the materials that we have developed, checklists and other informations, posters. To strengthen intersectoral coordination, we have this presidential task force, and there are different tiers: provincial level, district level, division level, village level. So this is like a cogwheel where all the levels have to take part for the guidance and also resource mobilization, advocacy, and so on. At the village level, so at the division level, that is congruent with the medical officer of health area, the other stakeholders of different ministries also meet once a month in the division development committees, and dengue is also taken up regularly. So this is a schematic diagram of it, and the medical officer health has a big role there with other sectors. Okay, so medical officers' efforts will keep on this cogwheel moved in relation to dengue and also for health issues like COVID and so on. If there is a hotspot where dengue is rampant, he has to get the support of other area to find solutions. So this is this platform has been made by dengue control unit at national level with the support of other ministries. So outbreak response is very much one of the major activities, because we mean to say that occurrence of more than one more cases of disease than expected for a particular period and area is considered as an outbreak in general. And when there are outbreaks, we have to investigate promptly before it spreads to other areas. So we have to there are some factors we have to control: human movements and human movements controlling in the sense that we have to advise them about visiting to other outbreak areas and protecting by wearing protective clothes, applying repellents, etc. And also cleaning programs through the intersectoral coordination is very much important. And at central levels also, we monitor the occurrence of outbreaks through DENSIS. I told you that we have a surveillance tool to monitor the dengue situation in the MOH level. And provincial level also, there are consultant community physicians and who has to advocate technically. And district level, we have regional epidemiologists, medical officers of health, entomologists, public health inspectors, and other staff. Also, we have developed this different levels. We have developed platforms for proper action. So it is the health sector who has to run this with constant data to the others. So based on the data, we have high-risk approach, priority high-risk MOH areas, moderate high-risk areas, and low-risk areas. And we conduct special programs according to the risk level. If I am to explain you about the outbreak activities with a case study, this is a classic example which occurred in 2020 in the third quarter. Our DENSIS data showed that after the 39th week, the cases have started rising in the Batticaloa district, and it has several MOH areas. Here you can see that compared to there are 4 districts in the northern province, and compared to the other districts, the Batticaloa district cases started rising, and it spilled over beyond 2021 to 2022. Sorry, 2020 to 2021 also. You can see here that at the beginning of the year also there are some cases. That is because of the rainfall in a northeastern rainfall which occurred towards the end of the year and continuing up to say January, February. There are some MOH areas mainly affected: Batticaloa, Poralapada Central, Valachine, Ottamavadu, Kiran, Kartankudi. So this area had a lot of cases, and these were the breeding places our entomological teams inspected. The outbreaks occur when their routine systems fail. So there have been lapses in some of the health activities. Maybe that this corona situation also has affected this. And these boats, concrete slabs in the congested areas, household receptacles to collect water due to lack of pipe-borne water, these tube wells where the water accumulates on top, and this open unattended tanks, because some people, when they get tube wells, they forget about the open tanks. So these were some of the risk factors, and the solutions actually. Solutions were, I mean, the people started mobilizing after the intervention by national level, because they were not so much, they have not given priority to dengue at that time due to COVID situation, because a lot of health sector have been mobilized for COVID prevention activities. So we have to implement all these activities. Some activities were there, but they were not sustainable, like covering these shallow wells. And this, as I explained earlier, these are some of the activities that we expect, multiple activities. So this brings me to the last component, research component. By National Dengue Control Unit, we initiated the Wolbachia method in 2 MOH areas. That is in Kalambu, Mattakule, Modere area, and also in Nugegode MOH area. And by Faculty of Medicine, University of California, sterile insect technique has been introduced in Gampa district in 1 MOH area. If I am to talk about Wolbachia method, Wolbachia is a bacteria. It's a naturally occurring bacteria, and it is present in some of the insects like butterflies, dragonfly, and so on. Naturally, it is occurring, but it is not it is not found in Aedes aegypti. So there is some research has proven, when this Wolbachia bacteria, which is a human-friendly bacteria, is introduced to the Aedes female mosquitoes, as you know, female mosquitoes carry dengue viruses. The presence of Wolbachia prevents multiplication of dengue viruses within the body of Aedes female mosquitoes. So in the Monash University, they have with technology they have introduced this Wolbachia bacteria into the eggs of the Aedes aegypti, and since the generation, the Aedes generation thereafter will carry the Wolbachia. These eggs have been brought to Sri Lanka also, and they were hatched in some mosquito containers. We call it mosquito containing receptacle, and they were released in these 2 MOH areas. So the release was completed in mid last year, and after that, every 6 months, we hope to collect we collect the Aedes and analyze them to see the frequency of Wolbachia within Aedes. So it is being conducted. This is what I explained you. Mosquitoes without Wolbachia, they transmit the virus, whereas when the Wolbachia is within the mosquitoes, they don't propagate the virus into the others. So the dengue transmission is reduced in those areas. You can see this. These are Wolbachia containing Aedes, and it mates with because for the Wolbachia to propagate, either it is the female who should have Wolbachia bacteria. So this is not important for you. Anyway, this in Australia and some other 20 countries, this project is being implemented. So this is what I have been explaining. It is not occurring in natural Aedes aegypti. It is called cytoplasmic incompatibility, the theory for Wolbachia to inhibit the proliferation of the virus within the body of the Aedes. So these are some of the actors. You can see former DGN in the CMC area, Modramattakul area. These are the containers that we put the eggs of the mosquitoes in a capsule, and when we add water, this is the egg here. When we add water after, and we hang it somewhere in the courtyard, and the mosquitoes with Wolbachia are released. So this really every week we hang it, and for about 20 weeks, and after that we expect that the wild mosquito, that is the old Aedes mosquito, will be replaced by the mosquitoes with the Wolbachia. These are the two. These are the areas, Modramattakul area, and this is this Nugegode Moch area. Sterile insect technique. It was conducted by the Kelaniya University, and the Aedes albopictus mosquitoes are sterilized, the males, and they are made infertile, so that the after mating with the Aedes females, the eggs also become infertile, thereby suppressing the mosquito population. So these are some of the techniques that that is how they release the infertile males to the community in Gampai Moch area. So we expect that the mosquito population is reduced, but as I mentioned, this cannot be the single method to control dengue vector. There should be cleaning of environment and constant community engagement to prevent mosquito breeding by other methods as well. So now I have about 10 minutes more. I will briefly touch upon the mosquitoes. There are two types of mosquitoes, Aedes aegypti and Aedes albopictus. These tiger mosquitoes which has white bands, and Aedes aegypti is the main vector. So they are here. They prefer human bud and trophophilic, and rests inside the houses in dark, humid surroundings. And albopictus is it is the secondary vector, and so it is generally found often outdoors and in vegetations, among vegetations, and but sometimes we get these containers with mixed infections at household level. This unused commodes, cisterns, and this sometimes in the gutters also, when they are this drainage, when they are lined with cement, and when the sediment settles down, it can breed in this clear water. These roof gutters, this flower plates, and this rainwater harvesting tanks, water pots. So all these places, if we look for these in our garden, we can find plenty of them. Construction sites, concrete slabs, sometimes in the plant axils and also tree holes, we have to put concrete or something to cover these stumps, bamboo stumps. So we have to cut at the joint to prevent the upper part getting water. So this human behavior is very much important. when we analyze the data that we collect from our entomologists from each district, in 2013, we can see that discarded receptacles constitutes 48%, whereas ponds, ornamental items, refrigerated trays, concrete slabs, cement tanks, water storage. But even though this pie chart contains several, there are so many. This has some selection bias. If you look for them in plenty, you can find different proportions of the contributions. So as we expand our services, we have found a lot of other places also. Covering item means sometimes we have seen that with the black polythene, some items are covered to prevent accumulation of water, like say concrete structures or any other machinery and things like that. But it is not even. So there are some puddles collecting on top of these polythenes. So they are also much important. So these things, why we collect this data? Because to give the correct message to the local area, it is important to find where the breeding is. So this is only primary prevention, remember, but for secondary prevention, you have to promote the message to seek medical advice once they get fever, for more, I mean, on the second day of fever rather, because sometimes when you say second day, third day, they are not coming. They are postponing coming to medical advice. So it is very much important. And also there are other messages like not taking any other NSAIDs drugs, and also taking paracetamol in correct doses, bed rest, and those things are also very much important activities to prevent complications. What the challenges we face is multiple virus serotypes circulating, and high incidence, and also this transmission. So we have to have strengthened program pre-outbreak times, and this rural settings spreading fast. So now I think all the areas, no area is exempted. Now it is spreading in those areas, and public engagement is very much poor because they have other issues, as you can see in life. So there are other diseases and other social factors which prevent them from engaging and looking for dengue breeding and preventing mosquito breeding. And intersectoral coordination is not sustainable always. It all depends upon the efforts of the health sector to get other sectors involved at different levels. And now I think this is a bit different now. Now, of course, people are not much, some are not very much engaged in COVID prevention, because now because the perceptions are different now. The risk perception is different. So now those days we had some problems where the dengue was compromised due to COVID situation, like notifications from hospitals are delayed by the nurses because they had to notify COVID cases. They have to more importance for COVID, and also PHIs didn't investigate the dengue cases from as soon as they get them. But and the vaccination programs are there, but now I think the dengue is gaining its due attention with constant communication from national and divisional levels. So this brings me to the end of my presentation. If you have any questions, I am pleased to answer. I am Dr. Nimalka Panil from National Dengue Control Unit. Thank you very much. No questions? Are there any questions?
Madam, the dengue vaccine, when can we expect it, madam?
Actually, I don't think we can expect it soon, because it is not easy. There are 4 types, serotypes, and there should be a tetravalent vaccine also. And there are some trials. Phase 3 is finished in one vaccine. But even if the vaccine is available, we can't give it freely to everyone, because there are some risk categories that we have to think of, prioritize the risk groups. And the dengue, even if it is available, the primary prevention activities will have to be continued as it is now. So it will take some more time, because it is not yet registered, even though in some countries it has been registered, but in Sri Lanka it will take some more time.
Okay, thank you, ma'am.
Yeah. I will ask you one question. Do you are you aware of the risk of mosquito breeding where you stay, whether you are a hosteler or day scholar or whatever? Because sometimes we have the universities have requested us to inspect some of the hostels and the university premises, and we have found breeding places in certain localities. So I think the students also have to be vigilant, isn't it? When last about sometimes back, there were one or two university students. I mean, especially when they get fever, they think of something else, and they are they are not they are not guided or more self-motivated to check a full blood count to see whether they have is it possible dengue. So always be vigilant that once you get fever, to exclude dengue, because in those two cases, the university students, the leaking has been started while they were in the hostel before they got admitted. So it's very much important to protect our lives and also advise others to do so. I think it's a take-home message for you. Thank you very much, and I wish you wholeheartedly all the best for your future career to be humane doctors. So thank you very much. If you need any help regarding dengue, about data or anything in your career, you are mostly welcome to visit our unit and talk to us for any support. Thank you so much.
Thank you, madam.
Okay. I will email this to I think one doctor who spoke to me. I will email this lecture. Okay, thank you very much.